COVID levels are 2 to 19 times higher than figures reported globally, a WHO official said on Friday, citing wastewater data. The news comes as the organization warns of the yet unknown dangers of repeated COVID infection, which can occur asymptomatic. Head of WHO's Emerging Diseases and Zoonotic Diseases Unit, Dr. Maria van Kerkhove, said that because most people have some immunity to COVID-19 due to vaccination and/or previous infection, we don't know exactly how often we get infected. A press conference in Geneva. What will we see 5 years, 10 years, 20 years from now in terms of heart failure, lung failure, neurological disorders? It's the 5th year of the pandemic, but there's still a lot we don't know about it. He said concerns about COVID infection are multifaceted, include potential acute effects such as hospitalization and death, the development of long-term COVID-19, what he referred to as even longer-term effects. He added that it is estimated that 6 to 10 of those infected with COVID will develop COVID over a long period of time. This is actually a real situation that needs to be investigated properly. Whether we accept it or not, the world is still in a pandemic, Van Kerkhove said, citing the virus' continued rapid evolution and lack of a seasonal pattern like many respiratory pathogens. What's more, he said, hundreds of thousands of people worldwide are now hospitalized with the virus and nearly 10,000 people have in the past month, probably more. In December, COVID hospitalizations and ICU admissions increased by 42 and 62, respectively. This world is currently experiencing surge in JN.1, the emergence of a highly mutated Omicron, some say, deserves new Greek letter from the WHO, like pi or rho. In U.S., this is now fueling the country's second largest wave of epidemic. Van Kerkhove said the ongoing impact of COVID is underappreciated. He said the death figures were based on data from only 50 countries and territories out of 234 that still report to the WHO. Hospitalization figures come from just 29 people, and only 21 still report ICU data. Of the 10,000 COVID deaths reported to WHO in December, more than half were from the United States and 1,000 were from Italy, he added. We are missing deaths in countries around the world. Just because countries do report deaths does not mean that deaths do occur. Because many countries fail report their data while some still produce and publish reports. Unfortunately, we're kind of back to scouring the web, finding every report and adding them our dashboard, he said. As of December 31st, the official death toll of the epidemic was 7 million, but he said the actual total was likely at least 3 times higher. At least in the near term, hospitalizations and ICU admissions due to viral transmission during recent holiday gatherings will continue to rise. The WHO fears that COVID, combined with infections from other seasonal respiratory pathogens, influenza, RSV, parainfluenza and T.